Unfortunately, a lot of healthcare systems are checking the box. Oftentimes, it's more jargon and marketing than anything else, saying that they've launched something for patient engagement or patient access. But do those patients using it actually get better access? As we move forward, how can we improve that? Are we improving that? There's a lot of people doing a lot of great work.
You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur, MD.
Hello, everyone. Welcome to another episode of Parallax. Welcome to another Monday. This also happens to be our penultimate episode before Season 8, Episode 150, which will be releasing in January 2026. Can't believe it's been 7 years. So this is, in that aspect and in that regard, it's a special episode. It's also a special episode for our guest, Dr. Sarah Matt, who is a new author, and her book will be releasing the week this podcast is published. Dr. Sarah Matt is Associate Clinical Professor at Upstate Medical University. She is a health tech strategist. She's ex-Oracle, and she's here to talk to the listenership at Parallax about her new book, The Borderless Healthcare Revolution. So with that introduction and without much further ado, Sarah, welcome on the show. Welcome to Parallax. Thank you so much for doing this for us.
Absolutely. Thanks for having me.
So, Sarah, I'm going to begin the episode by asking you the question on, what was the motivation to write this book for you?
So last December, when Wiley came to me to write a book on healthcare, I was really thinking through the polarizing events that have been going on in our world and how everyone feels so separated. And what was a topic that I could write on that would bring people together? And for me, that was healthcare access. No matter what crowd I'm in, no matter who the audience is, whatever medium I might be in, if I ask everyone about healthcare access, everyone has a story about themselves, their parents, their children, and their difficulty getting care, getting medications, getting what they need to have better health. And so I decided this was a topic that I could put a lot of effort into, do a lot of great research, and bring out to the public so that we can actually move healthcare forward in a way that isn't polarizing, but instead brings people together.
Excellent. So it's sort of inspirational that you were able to finish the title in a year. Tell us more about the title, and as you were writing this writing this book, what was it that you came across that you perhaps did not know or were not aware of?
So the reason I call it the borderless healthcare revolution isn't just because of the borders that we think of all the time. I think that when people hear the word border, they think of geography. But you can have no access when your border is digital literacy, when your border is a block away because there might be a great hospital near you, but you actually don't have access. And so I'm defining the borders as all the different things. And I take healthcare access and split into 5 different pillars: financial, geographic, cultural, trusted knowledge, and digital. And those are the pillars that everyone needs to have a foundation so that they can actually get the care that they need. So I'd say that for me, first, borderless healthcare revolution is all about breaking down those areas, not just geography, but everything else. And then your second question was all about what I learned that I didn't know before. And what I would say is that I've done a lot of great things in my career. I've been practicing medicine for a long time. I still do internal medicine charity care here in upstate New York. I've been building product development teams all over the world for big and small companies, all in health tech. But I really enjoyed the interviews that I did because they were real people stories, real physicians, real patients, real executives. And I think hearing these stories from real people made a huge impact on me. And I included those stories in the book. At first, I didn't know if I was going to do much storytelling within the book, but hearing those stories surprised me. And I brought those right into the book. And I'd say that was the most interesting piece of the whole journey.
I'm gonna ask you a question which just occurred to me as I was listening to you. Um, when you say when you use the word revolution, um, is it something that you aspire for it to occur, or is it something that you think has occurred? Is that a fair question to ask?
It's very fair. I think we are the generation of doctors that are going through this revolution. You have to remember, like when I went to med school, they gave me a Palm Pilot. And if we think about that right now, it was a huge deal back then. And today, when I tell my med students that I got a Palm Pilot on my first day of med school, they literally laugh at me. We have been in the generation that has done work on paper, has been on homegrown EMRs, has done Epic, has done Cerner, has had to deal with all sorts of different technologies coming in, out, et cetera. We've gone from open to lap to robotic. So I'd say that this generation of doctors, the people that are listening to this podcast right now, are the generation of doctors that are this revolution. We are all part of this movement. And we're really at an inflection point right now. AI has been simmering for a long time. This past year, we had advances in so many different areas, especially in large language models. And when I think about the year to come and beyond, it's hard to plan because the technology is moving and accelerating at such a pace that it's hard to predict. But this generation of doctors, you, me, everyone listening, we're the ones who have made all these changes and pivots throughout our career. And now we have to do this again.
That's fascinating the way you describe it. Sarah, and when you were putting the manuscript together, um, tell us about some of the barriers, not in terms of putting the information together, barriers in terms of how you learned about barriers which exist in our delivery of healthcare as of 2025 or 2026. Educate us about some of the barriers that you were not aware of existed, and whilst you were putting this title together, you realized that I did not even know that this existed as a hurdle to excellent patient care.
I like that. So, like I mentioned before, the 5 pillars of access: geography, cultural, trust and knowledge, financial, digital. And one of the things that's interesting is one of my colleagues who's a cardiologist in Manhattan, I had a great conversation with him. We went to med school together and he did all of his training in DC, not in DC, in New York City, and took care of some of the most, I'd say, economically disadvantaged patients ever. Because, that's a public hospital requires that. And he saw patients in those settings where they couldn't get to their appointments. They couldn't get the care they needed because they were looking for childcare. They couldn't get on the bus. They couldn't afford the taxi. They had to be at work. But what I found the most interesting is that now he has a private practice on, what people call billionaire row. And so he has financiers and CEOs that are his clientele today, but they still have problems with access. And so I think it's easy to say, oh, it's just economic, or, hey, these people have everything they need. But what I'd suggest is that he sometimes sees patients, whether it's telemedicine or in person, and then to get them back for follow up, his office is calling them 12 times with no answer. And then unfortunately, they'll see a patient back when they get an ED call saying that there's a terrible aortic dissection that's occurred 2 years later because they didn't get a follow up. So when we think about access, why might that group of patients not have access? Is it time? Is it trust and knowledge of the system? Is it the fact that they may feel slightly invincible? Maybe, but there's still people and there's still patients. So I think it's really important not to remove people from the access pool. Everyone's having a hard time. It may be financial, it may be geography, it may be digital, but there are ways that we can improve that access for every single person.
That's quite an amazing answer. Thank you for saying what you just said. Um, Talking about access, Sarah, and you sort of put this together post pandemic. But the one aspect about our healthcare system, which the pandemic you, exposed, for lack of a better word, was access to marginalized communities, equitable access, right? To the when I say marginalized communities, I mean I think it's across the spectrum of all color. This is not supposed to be a conversation, specifically based on the fulcrum of color. Although we do know that Hispanics and blacks and certain ethnicities were eh, disproportionately exposed, and some of the equitable access was brought to the fore following the pandemic. What are your thoughts on that? I mean, do you think that was something which, and I think it's in line with your title of borderless healthcare revolution, because we also want to transcend these man-made borders when it comes to ethnicity and race and socioeconomic status, and all those borders are also borders for me. So I think there's a more philosophical meaning to the title of your book. So my question to you is a two-part question. Question number one is, why do you think this gap, when it comes to access, this gap exists? And then second is, now that we've learned that the gap exists, and I mean several societies and even organizations did what they could do best to minimize that gap. I mean, several programs were introduced. Do you think I know we're not there yet, but do you think we've at least started to head in the right direction here?
So, totally a loaded question there, Ankur, and I appreciate it. We historically have not included so many different groups of people into our healthcare studies, into the populations that we're going to treat with X, Y, or Z. And so we have so much historical trauma, unfortunately, for the healthcare system, which means that ultimately there's not a lot of trust. And the pandemic has absolutely made that even more difficult because I think an even greater number of people don't know what's real and have a hard time trusting the healthcare system. So, yes, we have a big problem. I think that unfortunately, the United States has a very different society than other places. In Europe, as an example, there's more single payer systems. And in those areas, the basement level of care that everyone gets is a little bit higher than what we have here. So there's people still in the US who are underinsured or not insured. Um, I actually practice in a safety net clinic out in Oneida. It's a free clinic, and we're seeing poor whites, Amish, migrant workers, you name it, and they don't have any other access to care. But the thing is, they're right down the street from a hospital, or they're right next to Walmart. They're right near things. And I think what we unfortunately have done over the last 5, 10 years is built out programs to improve healthcare for everyone. However, that doesn't mean launching a patient portal. That doesn't mean doing one app. That doesn't mean having one little program where you invite mothers in for X, Y, or Z. Unfortunately, a lot of healthcare systems are checking the box. Oftentimes, it's more jargon and marketing than anything else, saying that they've launched something for patient engagement or patient access, but do those patients using it actually get better access? I'd suggest that that's probably a mixed bag. So, as we move forward, how can we improve that? Are we improving that? There's a lot of people doing a lot of great work. There's lots of doctors listening to this podcast right now who are taking care of patients day in and day out, spending nights and weekends assisting real people. There's no question that the work isn't being done. What I would suggest, though, is that we have to get into those communities and see what they really need. If I go 3 blocks down the road in New York City, I could be in a totally different world. And so by going into those communities and meeting the people and understanding what they need, then we can provide them with things. I think a lot of times we assume that certain tools, especially on the digital side, are going to be great for everyone, but no one asked for them. No one actually can use them because of reasons. So I feel very strongly about bringing in the communities that may not have amazing access into the discussion early before we implement tools or other programs to theoretically help them.
So, Sarah, what do you think are those tools? I mean, how can we help the marginalized minimize the gap when it comes to accessing healthcare? I know part of it is, I mean, correct me if I'm wrong, but I feel that the vast majority of it maybe the healthcare insurance piece. However, I've seen instances where despite good healthcare insurance, there still is gap when it comes to access, and that is the aspect which befuddles me. I don't understand why that occurs. Do you have any thoughts on that?
So you've really focused in that statement on the financial aspects of healthcare. And I think that when we only focus on one pillar of access, like financial, we don't solve the whole problem. So even if you have health insurance, it's still very difficult to get care. So in this case, we still have maybe a geography problem, a cultural problem, a trust and knowledge problem, or a digital problem. So I might have insurance, but making an appointment is just next near impossible. So some practices do real-time scheduling via, some applications. Some do it where you make a request. Some do it where you have to take 5 hours and talk to someone on the phone. But that's a huge barrier. And none of us like to do that. Then when we think about the rest of the journey for that patient, we are not open on nights and weekends, especially specialists. And so everyone who's trying to come to our offices, unfortunately, is taking time off from work, finding childcare, things like that. So there's a lot of pieces there that are hard to solve because we can't just find ways to get employers to give time off. We can't just find affordable daycare because unfortunately that's almost non-existent at this point. It's becoming very expensive. But then again, we've lost the trust. So specialists, unfortunately, oftentimes see a patient in some of their most desperate times, but they have to get really close and really deep really quick. And so building that trust instantly can be difficult, especially if you're seeing a huge number of patients every day. And if your patients like you, it almost doesn't matter how your care is because if they like you, they'll keep coming back. But if they don't like you, all of a sudden you're going to have a retention problem. So what I'd say is yes, the financial aspects, huge, no question there. They're very easy to see, but there's so many other aspects that are preventing patients from starting the journey to see someone, getting in the door, taking their medicine, or even coming back. And that's what I'd suggest.
I'm gonna just I'm gonna change. It's not a tangential topic. I think it's in line with what we were just discussing. But just gonna change the topic a little bit and ask you more about the book. So if someone who's picking up the title, um, what should they be expecting as they pick up the title and it intrigues them to read the book? What should they be expecting in terms of how the book takes them from point A to point B? That's number one. And then is the book divided into chapters?
So yes, there's 10 chapters in this book. What I'd say is that I really aim this book at two big audiences, leaders in healthcare delivery. And that can mean everyone from board directors to C-suite to head of a department to lead nurse on a floor. Because I believe that every level in a delivery system can actually improve access today. I've made the book very actionable. There's nothing worse than reading a book and then going, well, that was interesting. Now what? I also aim this book at builders, and that's what I've been my entire career, building technology, building programs, you name it. Right now, we're in a tough spot because the healthcare market is a great market for business too. So we see lots of players, especially in AI, coming into healthcare, not necessarily with expertise in this industry. And so, how can we make access actually a key differentiator and good for business? And so, when we think about those aspects, I think that a lot of healthcare startups and other larger organizations in pharma, et cetera, can really consider how improving access as part of the bottom line actually increases revenue, decreases cost structure, et cetera. When I think about the book, I didn't want to make this a textbook. I didn't want to make it a fluffy airport read. I wanted it to be a nice middle ground where everything's well referenced and there's great stories. I have stories in there from patients I saw myself. I have stories in there from docs like you and me, from executives in health tech, et cetera. And the stories really personify these problems and how they're being solved or how they're not being solved. I also put in a global lens because there's some really non-exciting ways to solve some of these problems. And it's working in different parts of the world. So I'd say anyone who likes to read nonfiction, especially in tech or healthcare, this is for you. And it's going to give you things you can do today to improve access.
When you were putting this together, Sarah, tell me some of the challenges as an author. I mean, you are a physician, you are a professor, you are a health tech strategist, you've worked with Oracle. Um, Now you are writing this book. As an author, what were some of the roadblocks that you faced or experienced, which you thought that you would not face or experience?
So, I mean, time is everything, as you know. And so I was working full time as a chief strategy officer at a startup called Savato, focused on remote robotic surgery during the entire writing of this book. And that was definitely an interesting balancing act because it meant that my nights and weekends were writing every time I could. Um, the other thing was when you're interviewing folks, you have to do it on their time. So some people want to get an interview at 9 p.m. West Coast time, and I'm on the East Coast. Some people are international or they're traveling a lot. So it was definitely difficult from a time perspective. But what I would say is that this one was my first book. It will absolutely not be my last. I learned a ton about the process and the journey. And I think there's lots of people who think, oh, I could just write a book, no problem. But man, there were a lot of steps in there that I didn't really realize were going to be so deep. But I'll tell you, my writing is even better because of it.
So I have another follow-up question to this, Sarah. So if someone, say for example, someone in the C-suite, right, or someone who is a division chief or a department head is reading your title, how would you recommend them structure their reading? Because I know you mentioned this is not something that you would pick up at an airport and try to finish in a flight or two. How would you recommend them go through the book and garner insights and also garner actionable sort of knowledge, right, that they can implement in their day-to-day lives as leaders to deliver the healthcare revolution that you are talking about?
So it's only a 300-page book. It's an easy read. So some people read really fast. If you can read the whole thing, wonderful. If you can't, I'd suggest reading the first chapter, learning about the 5 pillars of access, and then flipping to the chapters that interest you most, whether it's robotic surgery or AI or telemedicine, and ultimately focusing on the pillars that you're struggling with the most, whether it's cultural, digital, geography, etc. At the end of every single chapter, I have a checklist for healthcare delivery leaders, and I have a special area for builders. And so if you want to just get the juice out of every single one, go to the last page of every chapter and take a look. That's where I talk about how we can adjust our metrics, how we can build our business differently, what we can do with real people right now, how we can ensure that we're bringing access to the table every day. And I think that would be my suggestion for people who have some time, a little time, and a lot of time to read.
If you had a magic wand Well, so this is the hypothetical question, obviously. And so number one, magic wand, and number two, many dollars. Um, what is the first thing you would change with those respective sort of wishes or miracles? One being a magic wand, and two being lots of dollars in our existing healthcare system.
I like how you made it in our existing healthcare system because that's the tricky part. I think the lots of dollars and the magic wand kind of come hand in hand. If we could remove the financial pillar from the equation, that would help a lot of things. It would make it so that more people could get healthcare instead of having to make a decision between groceries and healthcare. And I also think it would allow us to focus on the other pillars of access: cultural, trusted knowledge, digital, geographic. Right now, the financial part is such a big one, and everyone sees it, regardless of your socioeconomic standing or the insurance that you do have or don't, that it's kind of the elephant in the room. Until we can figure out how to make the cost structure of healthcare work for real people, it's going to be tricky to make this work for everybody and give real access. But if I had a magic wand, I would remove the financial barrier completely. I'd use all those funds, get rid of that completely so that we could focus on the other areas and give patients real access.
Do you have any topics which you think we have not discussed about the book, which you would want to share with our listenership or our reader or the readership, the potential readership? And again, um, just announce when it's coming in forums which our listeners or potential readers can access to get a copy of the book. For sure we will be sharing in our show notes, where our listeners can get access to the book and where they can order the book. And of course, if they have any questions for you, then they can write to us and we can direct those questions to you.
Wonderful. So, what I'd say is that what have we not talked about that's in the book? I'd say the builder side is something we didn't dig into, but today, every physician is doing something that's not just straight patient seeing. And there's a lot of docs that are either starting new companies, are getting into the practice management aspect, imaging, you name it. And so when I think about builders, healthcare is the market. Everyone wants to be in this market. And so I do a ton of startup advising. And ultimately, I think that for those on the call that are doing stuff, not just 100% clinical practice, but dabbling in other spaces, as providers or as entrepreneurs, there's a lot we can do in this space. You've seen firsthand how access is impacting your patients. And building it in from the get go, to me, is the new table stakes and the new differentiator. If I go to a CFO and the rest of the C suite and bring a solution to bear, if it's not going to A, save money or make new revenue, and then really improve patient access in some way, it's probably not going to get approved. So think about those pieces as you're reading through. Even if you don't have a startup today, or if you're not doing anything past your clinical practice, think about what you might do if you were building and what products and solutions you're utilizing as a patient yourself. Now, this is a great conversation and I would love to continue it. So, anyone who's interested in the book, it is available everywhere where books are sold: Amazon, Barnes and Noble, independent bookstores, you name it. And it's called The Borderless Healthcare Revolution. My foreword is by Dr. David Feinberg, who's a friend of mine. And we worked together for quite a while at Oracle. What I would say is that if you want to contact me directly, absolutely contact Parallax. They're a great group of people. Or you can go to drsarahmatt.com and fill out one of the forms. I'd love to see you. I'd love to bring this conversation to your organization or just one-on-one.
Fantastic. And Sarah, anything you think we've not covered in relation to the title? And once again, congratulations. And as someone who's published a book of poetry, it was an anthology of 30 poems. This was 5 years ago. I know what it takes to get a book out there, and I'm still working on my quote unquote fictional title, which is yet to be released. But as so, congratulations. I know it's a lot of work. Anything which we haven't discussed, which you would like to discuss with the listenership at Parallax?
So, in today's day and age, we had problems with patient access, yes, but we also have lots of other difficulties in other areas. People that are listening to this podcast are burning out. Our nurses are burning out. Folks are moving away from the profession. I hope this book gives people actionable steps to feel like they're making a big impact today. So if you're on the edge, or your team or someone else is deep in healthcare and unfortunately is getting wound down, I'd suggest reading this book. I think it'll bring hope to them, and I think it'll give them a way to move forward.
Fantastic. That is a great way to end the podcast. Once again, it was our pleasure and delightful to have you on board at Parallax. For the listeners, thanks for tuning in. Do visit Amazon or Barnes and Noble or your independent bookstore and pick a copy of The Borderless Healthcare Revolution by Dr. Sarah Matt. You've heard from her on Parallax. If you have any questions, feel free to forward them to us. We'll be more than happy to share those questions with them. Like she mentioned, you can also visit her personal website, which we'll be sure to share, in our show notes. Thanks for tuning in. You've tuned in for 7 years, every other Monday. We've built a community for ourselves. So thank you for being a part of this community. I truly cherish each one of you. If you have any feedback for us, do share it with me in person. Do rate us and review us on social media or on your favorite podcast platform, whether it's Google Play, SoundCloud, Spotify, or Apple Podcasts. And until other Monday of 2026, which will be episode 150, thank you for listening.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app, or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/parallax. Thanks for listening.